Are you able to?
Yes, we're here.
Hey.
Hey.
Magic. It was like, boom, magic. Hi, everyone. Oh, somebody with a really cool handle. Roll a pineapple. What? Just joined. Hi, everyone.
Hi, guys.
Hello, everybody.
Somebody commented, your sign is inverted. Because I wrote it the right way, but on Instagram it looks inverted. So, but I just want to say, if you have aphasia, it might look like this. Yeah, it might look like this.
Really can admirate.
Yeah. Okay. So I'm gonna introduce myself. Hi, I'm Evelyn. I'm a speech therapist. I'm the founder of Aphasia SG. So I'm gonna pass the mic to my OT friends. Introduce yourself, please.
Okay, hi, I'm Sijie. I'm an occupational therapist. One of the person behind Innovative OTs.
I'm John, occupational therapist also, and the other person behind Innovative OTs.
Yeah. Yay! So the reason we're doing this IG Live is because it's Aphasia Awareness Month. And our OT friends have so kindly, jumped on board to support us, really to raise awareness of how important communication is in our daily lives. So I just want to plug a little bit for what we do at Aphasia SG. We have 2 missions. And right now, by tuning in, you are actually helping to fulfill one of our missions, which is to raise public awareness of aphasia and communication impairment. So that's one of our missions. And the second mission is to empower and support persons with aphasia. So we, both 3 of us, Sijie, Jan, myself, we work with persons with communication impairment all the time in the community, in the hospitals, and many of them are socially isolated. You don't hear about it, not because there are nobody like that, but really because chances are you don't see them out. So what we're going to do is to minimize the social isolation by providing programs. So at Aphasia SG, we run free community programs. We have 3 right now, which is ongoing. It happens twice a month. In fact, for one of our flagship programs, Chit Chat Cafe, it happens 3 times a month. So we used to run it face-to-face. We pop it up like a real cafe. But right now, because of COVID, right? So everything is like heightened alert and all that. We actually have gone online since last year. So we run Chit Chat Cafe online. We run our Aphasia Choir online as well. And we have a games and craft night, which is online. Yeah. Yes.
I think
okay.
Amazing.
So enough about
I think it's just want to add something. I think it's just quite amazing how you guys managed to transform everything from face-to-face to an online platform and still able to benefit so many people who has aphasia and still trying to create awareness at the same time. I don't think it's a very easy thing to do. So kudos.
Woo! Thank you. And I mean, you guys have collaborated with us. So we thank all our volunteers. It's really not easy, I would say. It takes a lot of trial and error, creativity, trial and error to see what works, what doesn't. Even things like camera angles, and trying to relay the message across this medium, right? It's not easy. But yes, we are so thankful to all our volunteers. Anyone and everyone who has ever volunteered for us in any way, we just want to extend our sincerest gratitude. We are nothing without our volunteers. Our entire organization is run by volunteers and people who are just very passionate about spreading the word of communication. Yeah, so thank you very much. Yay. Yeah. So yes, what's really cool about this IG Live is that we have prizes. Do you guys know what the prizes are? I'm just gonna
show them.
So, ta-da! Yes. So, last week we gave out pouches which were designed by one of our members with aphasia, and now we actually have limited edition reusable face masks, also designed by the same member who the designer actually. So it's really cool. It's a nice size. It fits my face and it's adjustable. So if it fits my face, it'll fit yours.
Yeah, and I think I really like the design. It's super cool and super fancy.
Yeah. Like, can you imagine wearing that and spreading the awareness about aphasia? I'm pretty sure people are like, what's that?
Yeah, free publicity as well.
Yeah.
What does it read, right? Okay, do you guys want to fire off the first question so that people can
Okay, so to win the limited edition mask, there will be 3 questions that will be asked at different points during this IG live, and it will all be related to what we have shared during this live itself. Okay, so we will start off with the first question. Okay, so first question to win that limited edition mask. Okay, name one community program organized by Aphasia SG. So the first person to write the answer will be the winner. The correct answer will be the winner.
So all you need to do is just comment, write your answer in the comment, and just quickly send it out.
Yeah.
So come on, guys.
So we've got an answer here by Brenna Loki, Aphasia at Choir. We've got some answers coming through.
The next one is
by Anne Moret.
Anne Moret. It says Aphasia Cafe.
Aphasia Cafe.
With oh, this is a tough one to pronounce.
Ongel.
Chit Chat Cafe, and we have
Ongel,
and Mighty Mouse, CCC. I suppose that's Chit Chat Cafe.
So we've got a few answers coming through. So first person was Brenna Loki.
Okay, but I think what happened is, if I'm not wrong, Brenna Loki actually took part last week, so we're gonna, give it to the next
second one.
Right? Yeah.
Okay.
And thank you so much for answering, and keep the answers coming in. Okay. Yeah.
So Anna Maria, you win this round.
Won the mask.
Yeah, we will get in touch.
Congrats. Yeah, you'll be hearing from us soon. Yeah. So okay, now we're gonna get into the meat of what we do as clinicians, right? Do you guys want to share, like, as occupational therapists, right? What are some of the challenges you face when you have to work with somebody who has aphasia or, like a communication impairment? Yeah. Yeah,
actually, that's a very good question. I think most of us probably have experienced challenges working with people with aphasia. So we actually wrote 2 today. So we're going to talk about 2 of the challenges that we have.
Yeah.
And we're going to flash it. And this time round, we are sure everyone can read it.
We got it right.
Okay, just to let y'all know, Instagram, right, it's like it inverts the text, okay? So this was what happened when I wrote SOT-SOT talk. It looks like it's mirror image. So what these guys have done, right, is that they have written the text in mirror image. Kudos.
Yeah. I was like, wow, my brain is working while I was doing this.
I meant to say you didn't use any mirror.
Yeah. Okay, anyway, so the 2 things that we wanted to talk about today is goal setting and also how we can identify underlying cognitive impairment. So basically, like, how do you differentiate whether it's aphasia or like whether it might be there might be some cognitive impairments? Yeah. So
and I think
for the benefit of maybe some followers and listeners who are tuning in, right, and they are not healthcare workers or clinicians, right, what do we mean by goal setting and why do we do it?
Okay, so most of the time as occupational therapists, when we work with our patients, we're quite client-centered. So we will talk to them, get initial assessment, we ask them about their routines, their habits, and everything. And usually during the phase of rehabilitation, we try to set goals to see what they want to achieve at the end of their rehabilitation process, what they want to work towards to, what do they find is most important to them during this period of recovery. And in a way, because we as OTs, we try to promote independence. We want to teach them skills to promote independence, and to them, we want to know what is the most important to them.
Right, so what you're saying is every patient, every client that you work with would have a different goal, right?
Yes.
Depending on their needs, right? Yeah.
Yeah, you're right. Yeah. So understanding what their goal is will kind of help to facilitate that process and also make the rehab journey more worthwhile and also more meaningful because it's very individualized.
Yeah, it helps to kind of tailor our interventions for them when we set the goals. Yeah. So, and also at the same time, when the client is involved in the goal setting, we are able to get their motivation to also like kind of empower them to be involved in their own rehab journey.
Right.
Yeah.
Yeah. And can I just say, it's not just OTs who do it. I think all good rehab therapists should do it. It's a very integral, part of our the rehab process, because it's not about what you want. Right? It's not about what you can do, but it's really about what the client wants at the end of the day. What's
definitely.
Let's talk about the challenges you said.
So when we talk about challenges, so like when you talk about goal setting, like from what we have mentioned, it's basically something where there's a lot of communication, there's a lot of back and forth, because you're asking the clients what they want, you are getting them to think about it, you're getting them to like tell you, set those goals and things like that. So with aphasia, and it's like a communication disorder, then one of the problem will be, how does these goals get communicated across, like to us, and like when we do maybe like those one of the few when they are able to actually communicate these goals, then whether like us talking to them about, okay, so how is this going to work out, how the intervention is going to be, whether they understand that will be another problem.
So I think it's really the process of the communication. When we talk to them, do they firstly understand what we are saying? Two, how do we ensure that they understand? And then the other one is when they need to tell us, express, how can we help to facilitate them expressing and helping to facilitate that goal setting. So I think it's just this.
Right. Yeah. So what I'm hearing is communication. And I mean, because when we gather case history and when we want to communicate and have a conversation with the clients and patients about goals, and if they have aphasia, what should we do, right?
Yes.
Yeah. Or like how can we go about it?
What's the current practice? So what I mean, like it is challenging. So what do you guys do now? And then I will chip in. Yeah, you share what you do now. Yeah.
So I think it depends on the setting. So sometimes we'll collaborate. We will ask the family members about their social history. So what do they used to do, their habits, their routines, what their likes, what their dislikes. And then we will also try, or at least sometimes I will try and talk to my patient to see how much they can understand. May try to get them to repeat if they can, to see whether the information is correct or not, and may try a variety of
techniques.
So
if let's say they are not able to verbalize, then sometimes I use like visual, like writing, or like like pictorial cues. And of course, then the usual technique of like speaking slower for them to like, try to understand.
Sometimes I do a lot of gesturing. Like I'll say, what do you like to eat? Or do you sleep? What time you sleep? So things like that. Yeah,
fantastic. I think whatever you guys have mentioned, right, is absolutely correct. I think one of the biggest challenge, right, in when we talk about questioning, because when we do assessments, sometimes the questions, case history taking, can be very open-ended. But really, I think with the person who has aphasia, right, we cannot, from the get-go, maybe ask such broad questions, right? So the type of questions that's being asked is really important. I would always say, if, for us, I think it's so important that we work as a team to actually find out from the speech therapist what exactly is the diagnosis and the assessment, and from there we can, move on to the next step. Because if you know already that, okay, there's going to be severe receptive aphasia, then you would definitely want to go in with, lots of paper and markers and pen to really keyword, right? So keywording is a very effective way to support someone's conversation. So at Aphasia SG, we train all our committed volunteers, right, with this approach called supported conversation for adults with aphasia, right? And there are many techniques. And the main principles behind it is, first, you must make sure the recipient understands, right? And there's different ways to actually understand that, right? Confirm and understand the message. And then when you are conveying the message, Jan mentioned this point about slowing down. So that's also one of the techniques, right? And then also to confirm, to actually double check, hey, is this what is being conveyed? So sometimes when we communicate without thinking through all these steps, right, you always just assume this person gets you the first time. But it may not be the case. I mean, let's not even say aphasia. Even if we are talking to a client, a patient who speaks a different dialect from us, right, they may not understand what we're saying, So I just want to say, like, with communication, it's not just limited to persons with aphasia. It's actually much broader than that, right? And in the community setting, in the hospital setting, we see clients of all profiles, all ages. I don't speak Hainanese, and when I meet and you know, elderly auntie who speaks only Hainanese, right? What the heck do I do? I actually use these approaches that I use with persons with aphasia, and it's applicable, right? So I think Sijie's example of gesture, that's fantastic. We always, you know, like especially with our programs being online right now, we gesture so much. We are very animated, we gesture a lot. And also just non-verbal, like just communication going beyond words. Meaning, don't just think of communication as words or verbal output. You know, the non-verbals actually reveal so much. So not just gestures, but your body language, you know, and eye contact, you know, and all that. It just says so much, lah. So, you know, I this is all like in a nutshell. I mean, I'm just gonna do a gentle plug here. If you want to find out more, join our Speak Forum, okay? We have like a much longer forum coming up, which is on the 26th of June. And we will talk about all that. But this is only a half-hour session. So so these are a couple of strategies I would say. But you guys are definitely on the right track, lah. Like this what you've mentioned. There's a question over here.
Got a question actually. How much influence do patients have over goal setting? Or do you guys exercise a lot more professional judgment in setting those goals?
So I think there's definitely some elements of individual clinician, clinical judgment and clinical, I don't know, like I would say different clinicians have different personalities or different beliefs. For me, I really like it to be a two-way conversation. Like I really like it to be a dialogue. I like to think that we are masters of our own lives, but only our own lives, right? And not other people's lives. So when I meet patients, I like to have a very open conversation with them. You know, I think the trickiest part is not how much autonomy we exercise as clinicians, but sometimes what happens is family members tend to overstep. And family members tend to override the patient's wishes and will. And it usually comes from a good place. It comes from a good place of love, but sometimes it's so hard for us as clinicians to manage that. Like you know, maybe your patient is like the husband, but then you have the wife telling you something else, but actually you know that this husband really only wants this thing. That's very hard for us. That's definitely a huge challenge for us as clinicians.
Yes, I agree. I agree, 100%.
Hey, thank you all. I think who just joined in. We are here, SOT-SOT Talk, talking about goal setting, talking about communication challenges and strategies that we can use.
So our second challenge that we identified, as in that we wanted to talk about today, is identifying underlying cognitive impairments. So more of like, how do you, like, let's say if you're new to aphasia, sometimes you may not know how to differentiate whether it is really aphasia or whether there is underlying cognitive impairments in a patient.
So what do OTs do to assess cognition?
Okay, so I think the easiest thing, or not say easiest, the most common thing that we often do is MOCA screening.
Sorry guys, MOCA stands for Montreal Cognitive Assessment, okay? And Donald Trump did it and said that, oh, he aced it, right? So that's MOCA, very famous for Donald Trump, okay? So that's a test. You can look it up. You probably can find templates online.
I think now they need... now I think you need to be registered.
I'm sure you can find some pirated version online.
So basically the common one would be MOCA. And then a lot would be from observations. So we kind of observe when they do functional tasks. For example, when we mean about functional tasks, for example, know whether they can make a cup of tea, put it on their own clothes, so all these things. So we see how they execute it, how they plan it, whether there's anything that's missing or kind of unusual. Then from there we will then see whether there's anything we feel that there may be some underlying cognitive impairment as well.
Right.
So
the challenge I'm just going to intervene a little bit to the viewers who just joined in. We're talking about cognitive assessments in brief. So, we know that somebody with just pure aphasia doesn't have cognitive issues, but the language problems makes it so easy to misdiagnose, as a cognitive issue. And even doctors get it wrong sometimes, doctors, nurses get it wrong. So we're talking about the challenge of assessing somebody with aphasia. What kind of tools do we use? And OT's talked about observational screeners. Yeah. And anything else that y'all use? That's it, right? Yeah.
I think it depends. So there are more other standardized assessments that's out there, but whether it's suitable for patients with aphasia, then it becomes a grey area because of the cognitive, because of the understanding segment comes in. So if they have very poor receptive or understanding of the instructions, then that will kind of affect the execution of the test itself. So I think so I would say for patients with aphasia, at least from my experience, would really be a lot more observational sometimes.
Yeah. If they can share my part there, I really, even though I am certified to do the mocha, I really hate the mocha when it's especially, so not all the time, but I hate it when, you know, the person has a left hemispheric stroke. No, so you know that likely aphasia is really the diagnosis, right? And still, you know, sometimes the doctors may order mocha, or like sometimes some unknowing clinician performs the mocha on a person. I just feel like it's so unfair. It's like asking somebody who doesn't speak, it's like asking me who doesn't speak Japanese to do a test in Japanese, you know. It's like, what the heck? Why would you do that to someone, right? And that's what happens with mocha. This test is so linguistically demanding. It's basically it's just words. So there are 2 tests for COG screener. Okay, so the challenging thing is somebody who has aphasia can also have cognitive impairment. It can be comorbid. So we're not saying that, if you have language impairment, you have no cog impairment. No, it could be comorbid. If it's pure aphasia, yes, there is no cognitive impairment. But somebody could have, like, maybe the stroke happens not just purely on the language lobe, right? So I like to use these 2 screeners. One of it is called VCAT, and it's actually locally developed by NNI. VCAT stands for Visual Cognitive Assessment Test. You can look it up, right? It's a really good tool. So what it does is it takes away the language, and there is actually a screener on the first page. On the first page, you're supposed to name, the person who is being tested will have to name something and name a place. If they cannot even clear the screener, we cannot continue with the test, right? So this is a really good test for aphasia. If they are very, very mild, then I can proceed. If they are not mild enough in their language, if their language ability is not good enough to continue with this test, then I wouldn't continue, right? So I call it VCAT for short, and I think VCAT is a really good COG screener. The other test that I like to use, I heard that it's already pulled out of circulation. It's developed by a speech therapist. It's called CLQT. So CLQT stands for Cognitive Linguistic Quick Test. And sometimes, depending on the person that I'm seeing, right, I might even pull up bits of the test, right, to just assess the person. So it comprises things like maze, you know, like M-A-Z-E, maze, mazes, and then there's things like clock drawing, which of course is on mocha as well. But you see, the thing is, mocha is not just about clock drawing. There's so many other elements that requires language, you know, and even the memory task on a test like VCAT, right, is not so linguistically demanding. So it is more ideal with somebody who has a language impairment. Yeah. Yes, thank you so much, for typing it up. So these are 2 tests, I realized that we've gone on, and we're supposed to have our second question, right? Our second quiz question, Can we just ask a really simple question? I mentioned earlier about a test that Donald Trump took, right? And a test that I hate. Can anyone just type the acronym, the abbreviation for this test? Like, what is the name of this cognitive test? Yeah. It sounds like a drink. Donald Trump took this test, okay? Yeah. And he was very howling about it.
Let's see whether anyone can get it right.
About it earlier on.
So for those who might have joined in new, first person to answer. Savvy Monster.
Yes,
mocha. You got it right.
Yes, mocha. And not like the drink, mocha. Great, you're most welcome, Teresa. I think in our profession, it's all about sharing knowledge. We shouldn't keep what we know lah. I mean, it's all about the benefit of the patient. If you're keen to find out more, join us at our Speak Forum on the 26th of June, where we will talk a lot more extensively about all these things. Yes, thank you so much.
So, Debbie Wong, so we will get in touch with you on Insta message. You have actually won yourself a limited edition aphasia mask.
Hey, there's a mocha. Oh yeah. Don't try to display the mask. Yes, you have won for yourself a limited edition mask. designed by our member from Aphasia SG. Yeah.
Okay. We have one more question that we will be asking in a while. So those who would still like to win the mask, just stay with us. Okay. And yeah, fastest fingers.
Yeah, maybe we get. I think time is running short, but I think we can still talk about something that's I think quite interesting. Actually, I want to ask Eve. You know what are some of the apps that ST uses when you work with patients with aphasia? You know what are some things that you use?
Yeah. So the couple of like really you know, and actually all this information it's you can find it online if you have enough time to go and look it up, right? So the couple of big companies out there. So Cactus is like a really big company. With Cactus,
you say Cactus? Like the
sorry.
plant?
This after Cactus.
Oh, Cactus.
It's like the company TACTUS. Cactus. It's really like the leading company right now for a lot of speech therapy apps. They have the full suite anything you want also they have but unfortunately the apps I would say it's good and I use a lot of it you know, they have free versions, but with the free versions, right, they just give you like trial 10 items, so it's hardly enough. And I feel sad when patients, they want to do more, but they have to pay. So there's another company, Lingraphica, that provides free apps that you can download. Lingraphica.
How do you spell it? So that I can
figure it out. Okay, Lingraphica. Lingu, Lingua, yeah. Lingraphica, Phica. So there's another company. So Cactus is the company, and then there's Lingraphica, which provides also a therapy app, and they also have a news app, which I find really interesting. You can use that news app, right? There's a reading function, and it's all like 1 minute bite-sized news and very current affairs. It's great. So these are some free apps. And the other app that I like a lot is Constant Therapy, which unfortunately isn't free for patients and clients, but it's a great app. It's developed by Boston University. So yeah, try it out, you know, like use these apps, you know, with your patients and but I must say you must try them out yourself first, because not every client is suitable to use these apps, right? I noticed that it's almost 9, so
we're gonna pop the last. Can we pop the last question?
Hold on now. I think we just have a few questions here and there.
Okay.
One by Dina Jumat. Will the mask be sold online?
You like it?
Yeah, she said it's very pretty.
Yeah, and you try to win it then you don't need to buy. Yes, we will sell it online at some point.
I think she won the pouch last week. Okay, and then we also have Carissa who mentioned that she wanted to see if there are articles that can be shared with the viewers. I think at this point we don't have any article per se, because these sessions are short. But of course, with the Speak Forum, like maybe there might be some references and resources that we can actually share with you guys. So do join us at the Speak Forum. It's free. We will actually put the link up in our bio, so y'all can just click that and sign yourself up.
But first, join the Choose Your Own Adventure that's happening this weekend.
Yeah.
Yes. Oh my god, I forgot to say. Okay.
So the link is already up in our bio for the Choose Your Adventure event. So I think it's quite interesting and it's quite cool. So if I'm not wrong, the youth volunteers at Aphasia actually designed and created this game, and so you get to see the perspective of someone who has aphasia, and you get to choose. In this game, you get to choose how things are going to be like. I haven't joined it. I don't know what's going to happen. So I will want to see, and I want to experience for myself how it's going to be like for me if I have aphasia. You know, I think it'd be quite interesting. It will actually allow us to really better understand. So I think it'd be quite cool.
Definitely. I think we encourage everyone to join us for these 2 upcoming events. So we have Choose Your Own Adventure Aphasia Edition this coming Saturday at 3 p.m. and we have our Speak Forum next Saturday at 4 p.m. Yeah, all are welcome. Though I must say, with the Speak Forum, we are targeting more. It's going to be a lot more technical, clinical. But hey, I mean, just come with a learning open mind, and then even if some of the information flies over you, never mind just learn right? I mean,
I'm pretty sure we can simplify it and answer questions.
I think before we kind of end this session, we're going to pop the last question. The last chance you can win this mask. Okay, so we're just going to repeat the rules. Okay, after we ask the question, okay, the first person to type in your comment, you get a chance to win the Aphasia mask that Evelyn is wearing now. Okay, so the last question that we're going to ask, okay, name one speech therapy app that Evelyn has mentioned just now that you can use for people with aphasia. Okay, Bryna, good luck.
I'm not. You won last week already.
It's okay. We welcome participation. We welcome his participation. But it's okay, Bryna. Just try. That's why I say, oh, Mighty Mouse.
Okay, but Mighty Mouse got it right.
It's
cactus.
Yay.
Oh my god, I'm just so ashamed of myself. Cactus, guys, not cactus, but cactus. It's in a cactus, not cactus. Sorry.
Okay, so I think we just blame on technology this time.
Okay, so Mighty Mouse, you won yourself
Aphasia SG mask.
Yeah.
Okay, we're sad to say, guys, we've come to the end. We reached our half an hour mark today.
Yes, actually we have passed our half an hour mark. So we will be sharing more. If you found the session today interesting, we'll be sharing more next week about strategies that you can use and challenges that we face, how we overcome some of these challenges. And definitely join us for our 2 upcoming events. Choose Your Own Adventure this coming Saturday and Speak Forum next Saturday. Go to our bio, so either Innovative OTs or Aphasia SG. You can click on our link tree and you will find the link. Yes.
So I think just a shout out as well. This is actually the second of the 3 sessions that we're gonna have. So thanks for joining. So fast, sticking around with us for the 2
one
sessions.
more SOT-SOT talk next Wednesday.
Before we become Speak Forum.
Thank you all so much for your time. Thanks, guys.
Thanks, Evelyn. Thank you.
Bye.
Bye.